Let's shine by seeing the best in all of us and by treating you here, right in your hometown. Let's look out for each other. Let's stay healthy. Let's shine together.
Hi, I'm Sharrie Harlin Davis, program host for Let's Talk Together. And today we have as our guest Maria, Barbie, Will, but for the rest of the show you'll be Barbie.
Yes.
And April Coffin from Reid Behavioral Health. Welcome, ladies.
Thank you.
Thanks, Sharrie.
And before we get started, tell us a little how you both came to Reid. We'll start with you, Barbie.
Oh, sure. So I actually came to Reid for April. She and I worked together before, and I loved working with April. And so they had a therapist position open, and I jumped at it. So I came to Reid in 2019 after I had my youngest son.
And I lived in California and moved here and worked for another organization for a short period of time, but I wanted to work for another organization who was very community driven, and I had a lot of respect for Reid, and I saw what they did for our community, and I just really appreciated it, and I wanted to be part of that. So I chose Reid, and I'm grateful they chose me.
Well, we're so thankful to have you both on the Reid team. And more and more in the news, we're reading about mental health. So today our subject is promoting mental health in the workplace. So I'll let you start, but one of the things, like part of breaking the stigma of mental health is discussing what we're seeing in all areas of life. So that includes our mental health. And we spend the most hours at work and in the workplace. So why is mental health so important in the workplace?
So mental health is important just for our overall well-being. But I think a huge part of whether or not we're actually addressing our mental health is all about workplace culture. You know, are you working for an organization that is supporting your mental health? Are you working for an organization that prioritizes mental health? And, you know, are you working for an organization that has policies that help workers, staff feel comfortable even talking about mental health? Are you working for an organization that, you know, prioritizes having services for their employees, you know, like EAP programs? And on top of that, so
just jump in
sure,
there.
Sure.
And explain to our audience what EAP is.
So EAP is the Employee Assistance Program. So it is a group of individuals that their focus is to help employees with any needs that they might have. And so usually when people think of EAP, they think of counseling services, therapy services, but they also offer more than that. So I know a lot of times they'll offer like financial coaching, life coaching. I'm trying to think of anything else they might offer. I know that some can even offer like connection to different providers that you're needing, like maybe legal services. They can offer you that connection to someone in the community.
Okay. So another thing is, as we discuss, more and more it's common for people to talk about mental health out in the open, per se.
So it definitely is. I think, especially with our younger generation, and I really applaud them for that. Our younger generations are making it more acceptable to talk about mental health. And I think that, especially with social media nowadays, we're definitely talking more about mental health. We're talking about symptoms, bringing more awareness to certain disorders. And I really applaud the progress that we're making towards being more open about mental health, because so many people struggle with mental health. And I actually have some statistics that I'll talk about
Okay, I was
later.
just
so
about
that
to
we
say, so what are some of the current statistics that we're seeing in adults as it relates to the workplace?
Oh, absolutely. So as we know, people that work full time, they spend on average 8.8 hours a day in the workplace. So time spent is more than the average person sleeps at night or spends time with their family and friends or participates in leisure activities. So that's, we just spend an enormous amount of time in our workplace, whether we're commuting, we're actually at work, or even when we're off of work, sometimes we're still thinking about work. So we're not necessarily emotionally available to our family and friends, even off of work. So it's no wonder that the workplace creates or has a significant impact on our mental health. So workplace stress can negatively impact our job satisfaction, our well-being, and tension of our coworkers. So I did jot down some statistics I wanted to share, so I typed them up so I didn't butcher them. So according to Mental Health of America, 4 in 5 workers report that workplace stress affects their relationship with family, friends, and coworkers. 4 in 5 workers feel emotionally drained from their work, and that's an early sign of burnout. So I just want to step back, and 4 in 5 is 80%. 80% of our employees and workers in the workforce are feeling this way. That's a very high number. 1 in 4 workers are experiencing more serious signs of burnout, including reduced personal efficacy and cynicism towards their peers and their jobs. So chronic workplace stress and burnout can lead to mental health concerns if it's left untreated. And then depression and anxiety causes the United States economy $200 billion in lost productivity annually. That is a lot of money that we, as a society, are impacted by mental health. And that's why it's so crucial for our workplace to have those strategies in place to help us with our mental health.
Have we seen an increase in in anxiety or mental health concerns in the past year as opposed to years ago?
So it's a little complicated. So the research that we have now, the statistics that we have now, is from data collected in the middle of the pandemic. So this was data that was being collected in 2020. So they started in March of 2020. They took a break for a while, because COVID was really ramping up. And then in July of 2020, they got back to it. But because of COVID, the sample sizes were smaller. And so while we have some statistics, they really can't be compared to the previous years just because of the impacts that COVID had on sampling sizes. Okay. But I also jotted those down to make sure that I didn't get them incorrect in here. But some of the statistics that we're seeing, and I'm only going to be reporting out on adults. I didn't include youth in there. But one of the big ones, 1 in 5 adults experiences mental illness. And so when you're looking at 1 in 5, we're talking about 53 million. 53 million people in the U.S. are experiencing mental illness. And I think one of the really troubling statistics for me is that only 45% of those people are actually getting the services they need. So 55% of people with mental illness are not getting the treatment that they need. And then 1 in 20 adults, so that's roughly about 14 million, are experiencing serious thoughts of suicide. So that's a really high number of people. And then we've got 28% of adults with mental illness reported not being able to get the services that they need, and the number one reason being that healthcare is so costly and they can't afford it. There's so many people still uninsured. Another statistic that I had, which I think really gets to the heart of what a big problem is currently in mental health, is that for every one provider, a mental health provider, there are 350 people needing mental health services. And if you're looking at the average therapist, an average therapist can only see about 10 to 20% of that. And so you've got 80 to 90% of people, you know, seek for one provider that aren't able to get those services.
And another thing I'd like to add is, now you're starting to see your regular insurance cover mental health services. So even if you had insurance, mental health wasn't covered.
Right.
So
right.
that's been a big plus lately, as we're starting to see more and more mental health services that are
Definitely.
covered.
Definitely.
But we still need to have more providers so that you can get
Yes.
services. So I understand
and
that.
so one of the impacts that COVID has had that I've noticed in our own practice, so I didn't have any local figures, any local statistics, but being the clinical manager and April being the director, one of the things that we've seen is for our practice, so outpatient behavioral health, and we have several locations. So we're talking Connorsville, we're talking Richmond, Cambridge City, Eaton, Ohio, Greenville, Ohio, Newcastle, Indiana, Brookville, Indiana. I think I got them all.
I think so. Good job.
But since COVID, our referrals have tripled. And so I'm really excited that people are reaching out about mental health, but then it goes back to that issue of we just don't have enough providers. So it's taking a while for people to get into services.
And which also it's leading to burnout. So not only even from the provider side, but then actually the employee side. So what is burnout?
I definitely want to talk about burnout. Can I just mention something
Sure.
about the post-COVID? So I wanted to just mention, I mean, I think we've all seen a decrease in our workforce. So post-COVID, COVID not only exacerbated our mental health crisis, but it's also forever changed our workforce and our workforce stressors. So as employers, we play a huge role in providing that mental health support for our employees. And I think as managers, we're always aware of what can we do to support our staff and retain the current staff that we have. So there's no one size fits all, and every organization has different types of employees in different areas. So I just wanted to just explain kind of some of the effects that we've
Okay,
seen
please do.
post-COVID. Yeah. So economic stressors, right? Economic anxiety, the loss of the labor force, that has been very challenging and has hit multiple fields, especially I think because we're in the healthcare field and we provide such crucial services to our community that it's one of our big stressors that are on our mind. And just trauma is still impacting us, right? Like people have lost a lot of friends and family to COVID and to other illnesses during this time period. And so also people are stressed and have anxiety about kids and themselves going back to school and going back to the workforce. So people got used to working from home and then coming back into the workforce. So they definitely COVID has had an impact on us. So then that leads into burnout, right? So burnout, I wrote the definition, so I didn't get that wrong too. So according to the World Health Organization, it defines burnout as a syndrome resulting from chronic workplace stress that has not been successfully managed in a condition specific to the workplace. And then also, according to the APA Dictionary of Psychology, burnout is defined as a physical, emotional, or mental exhaustion, accompanied by decreased motivation, lower performance, and negative attitudes towards oneself and others. So there's three primary reasons for burnout, or primary symptoms, I apologize. So emotional exhaustion, reduction in self-efficacy, and then cynicism. So on the screen, as you can see, emotional exhaustion is just basically feeling emotionally drained and having depleted energy and just feeling restless. And I would say a lot of people I speak to, multiple fields, they feel emotionally exhausted. So that's a high one. And then reduced self-efficacy. That's basically just lacking your confidence and personal ability to complete tasks. That's when you're emotionally exhausted and you start wondering, wow, am I making a difference in my position? Like you just don't have the confidence in your ability. And then cynicism, that's losing that feeling of empathy towards others, or just being more resentful and feeling hatred towards your job, towards your coworkers. And no one wants to feel that way, right? We want to love what we do, and when you start feeling that way, it's an awful, awful feeling. So I just wanted to say, like, the first thing that we can do if we're experiencing burnout is just feeling self-aware. Ask yourself these questions, right? Like, am I making a difference? Am I feeling like my work is meaningful and contributes to my organization? Do I feel more irritable towards others? And do I still love what I do? And if you answer yes to any of these questions, then consider taking a vacation or even a staycation. I mean, you don't have to spend money. You can stay home, and consider with the help of your manager, reducing some of your caseload if that's possible, and then even potentially asking about a new project or something you could do different.
And that leads into, so what are the signs of because burnout leads to a toxic work
Yes.
environment. So what are the signs of a toxic work
No, that's a great question. So I would probably say the biggest thing that comes to my mind is lack of boundaries. So anytime your work encourages you to not have a work-home life balance or encourages prioritization of work first, that is a huge sign. And I'm going to say that's really hard to do, right? Because we've lost a lot of people in our workforce. And so all of us are wearing multiple hats. But we still have to have that work-life balance. No room for mistakes, not supporting our employee growth, high turnover rates, low team morale, any type of passive-aggressive behaviors, lack of support from management also, and then people pointing fingers. That's always a sign of toxic work life. And then I just want to mention also, like, being in a fight or flight mode, right? So like our body and brain, when they're on a high alert, that should trigger you to think like something isn't right, because you should not function very long. Sometimes being in that a fight or flight can be motivational, but if you're consistently living in that mode, then that's not healthy, and that will definitely lead to burnout. But that's a sign of toxic work life.
Then, so that can lead to mental health conditions again. So it's so I'm seeing it says 1 in 5 workers will, because of the toxicity in the workplace, that 1 in 5 workers will experience mental health conditions.
Definitely.
So, do you want to expound
I was
on
saying,
that?
definitely, and I apologize. You know, and again, and so that's why it's so important to have to work for an organization and to have organizations that prioritize mental health, is because like so many of our staff. You know, we do have those workplace stressors like April was talking about. We do have those toxic work environments. And, you know, and sometimes those things are out of our control. You know, some people, they accept a new position, they go into the position, things seem great, and as they get comfortable, they start to notice some of, you know, the stressors in the workplace. And so it's really, really important that organizations do prioritize mental health, because so many, 1 in 5, that's a lot. So, our office, we have about, 30 people. And so that means at least 6 of our employees are going to be struggling with mental health.
And if you think an employee is experiencing a mental health condition, what are some of the steps that we should be taking?
So first,
to help them.
So first, we definitely want to educate ourselves on mental health and mental health concerns. There's a lot of great resources out there. That's the great thing about the internet. You know, we have so much information at our fingertips. And so I think just educating ourselves about mental health, because then that leads to less judgment and that leads to more open conversations. And so we also want to make sure that we're asking questions, and that we're asking open-ended questions, and that we're actually listening. I can't stress that enough, because so many times we're in that fix-it mode, especially with our coworkers, where we want to help fix a situation for them, because we don't want to see our coworkers struggle. Because like if they're struggling, this is going to probably impact me.
Right.
And so with that, we want to make sure that we're listening, that we're not trying to be ready to say what we want to say. Because a lot of times we do get into that mode where we're listening, or we think we're listening, but really we're just like, okay, what do I say to this? What do I say to this? But really, it's all about validation. I think a lot of people that are struggling with their mental health, they want to know that somebody's listening. They want to have somebody they can talk to. They're not necessarily looking for advice, even though we're very quick to offer it. They may not be searching for that. And so we want to make sure that we're listening, offering support, understanding, not showing any judgment. And we also want to make sure that we're encouraging our coworkers to, either reach out to HR, reach out to EAP, any resources that your organization offers, as well as any local resources that may be available. So like if you're familiar with some of the community mental health organizations, maybe you can tell your friend, like reach out to Meridian, reach out to Centerstone, reach out to Reid, to get the help that they need. Another thing that we want to make sure is, as managers, being in a management position, that we know the steps, that we know how to address that when an employee brings that to us. How do we go about it with HR? What are appropriate conversations to have with staff? And then we want to also make sure we're in a mentally healthy headspace too, as well as know our own comfort level with mental health.
I also think it's important for managers and leaders to just have that emotional intelligence. And I know that's not natural to some people, but I think that getting training and becoming more of an emotional intelligent leader, because we do have to be there for our staff. I think that from just looking at different types of organizations that have less commitment to being available for their employees, they see a higher staff turnover rate, right? So like Barbie said, we have to actively listen to our staff. We can't just go into the fix it mode and just say, we're gonna make this better, or we're gonna demand all this stuff. It's hearing what they're saying and being able to be emotionally available for them. And that's hard when we also wear multiple hats. And so I think, as Barbie mentioned earlier, working for organizations that have policies and procedures in place to have that for their employees is crucial.
So, for instance, what happens if you're in an organization and you recognize they don't have those policies in place? What are some resources that they can use?
So a lot of the resources that I'll often give my patients, there's NAMI. So that's the National Alliance for Mental Illness. I believe I got that right. I actually use them a lot. And then because I do have people who reach out to me, even if they're not patients, who say, like, where can I get some resources? And then so NAMI has an excellent website that can connect you with a local chapter. They can connect you with support groups, individual services and support groups, not only for the individual, but for any caregivers. We also have Mental Health America. They have a national website that kind of offers the same thing, connection with some of the local resources that are available. They also have some screening assessments too. So say you want to see if you're really experiencing depression, they actually have like a depression screening, and they have several different screening tools. I think there was like a bipolar one, stress one, depression one.
So what are some steps or resources if all of those things that you've mentioned, they don't work?
Well, I think as employees, you should advocate, right, for those services in your workplace. And so going to talk to your supervisor, managers, and directors, as well as HR, and just advocate for that.
And so what are some resources that are available at Reid?
Oh, that's a great question. Yeah. So Reid Health has that employee assistance program that Barbie discussed earlier. So that's a great resource for our employees and even their family members. We also have Code Lavender, which is a resource that's available currently to the inpatient tower at Reid, and it's for those just employees who have a mental health moment, and it's a crisis debriefing for them. And then for outpatient, we offer outpatient behavioral health services. So we have counseling, medication management. We even have a pediatric neuropsychologist who does evaluations, and an adult psychologist. And so we also love working with our community partners and hooking up people with connections.
Yes, definitely. And I was going to say, and then so we do have employees that do reach out to our outpatient office, and we're very respectful of privacy, and that was something that I wanted to mention also, as far as, you know, that workplace environment is.
Yes.
We do want to make sure that when people are talking to us about their mental health, that we are respecting their privacy, because we don't want to have that toxic work environment where people don't feel open to talking about it.
And your actual offices that people could go to or contact you at, where are they located?
So we have our office. So our Indiana offices are Richmond, Connorsville, Cambridge City, Brookville, Newcastle, and then our Ohio offices are Greenville and Eaton.
And we will soon be in Winchester as well. We're really excited about that outreach location.
Well, that's great. We want to thank both Barbie and April for joining us on this great conversation on mental health in the workplace. And thank you, our audience, for joining us today on Let's Talk Together.
Let's shine by seeing the best in all of us and by looking out for each other. Let's stay healthy. Let's shine together.